All right, we're set.
Hi guys, welcome to our Zoom Metro Detroit Macomb Birth Circle. We are very grateful that you came, and I'm very excited for our speaker this month for April. Maria Gahry is our guest speaker, and she is an expert on thyroid health and function. We know that at least 1 in 8 women will have a thyroid situation in their lifetime. And I think this is a very under talked about concern, and education is power. So we are going to give the floor over to Maria. She can do her own introduction. If you have questions as we go through the presentation, you can just type them in the chat box. Make sure that your microphone is muted during the webinar here, and then I will read your questions at the end of the talk. Okay.
Hello. So I'm Maria. I am a doctor of nursing practice. I am board certified as a family nurse practitioner. I currently practice at BioEnergy Medical Center in Ann Arbor, Michigan, and I am just over my 4-year mark in practice there. So I will go ahead and get started. So basically tonight's talk is about thyroid health during pregnancy and childbearing years. Even if your situation is outside of that period of time, a lot of what I'm going to say tonight is relevant, and you'll see as we make our way through. So what's the big deal about the thyroid? Just some statistics on thyroid issues themselves. More than 12% of Americans will develop a thyroid disorder in their lifetime. This is definitely a female-dominated concern because women are 5 to 8 times more likely to have a thyroid problem than men. Most people with thyroid issues, including pregnant women, are unaware of the issues. And again, as we make our way through the presentation and we start talking about symptoms, you'll see why that is. Having an undiagnosed thyroid problem puts patients at risk for many serious conditions. So cardiovascular disease, osteoporosis, and infertility are some of those things. And most causes of thyroid problems are unknown, and that's in parentheses because we actually have a pretty good idea of what causes thyroid problems. That's just not always well defined in the conventional literature. So the other reason the thyroid is a big deal is because the rates of infertility in the United States right now. About 13% of couples in the US are going to have problems with conceiving. And the issues are equally divided, a third being female infertility, a third being male infertility, and a third being issues with a couple together. Frequently unexplained infertility is a result of some type of immune dysfunction, and that's not something we're really going to get into tonight, but it's worth noting. The other reason that making sure the thyroid is optimized is a big deal is because of children's health. And this is a statistic that's floating around a lot these days, but 54% of children have a chronic disease in the United States. Now, I don't think that has everything to do with thyroid, maternal thyroid function. But I think that there is a relationship. As we'll see, thyroid dysfunction in pregnancy is linked to outcomes for intelligence, motor development, as well as behavior problems. So just some facts about the thyroid. It is a butterfly-shaped gland at the base of the neck. It regulates most body processes. And I kind of consider it the captain hormone because not only is it controlling a lot throughout the body, but it signals other hormone function. So breaking down the thyroid hormones, when you go to your primary care, your OB, they're likely going to screen you with a thyroid stimulating hormone. And we're going to get into issues with screening. But thyroid stimulating hormone is the signal that comes from the pituitary gland in the brain directly to the thyroid. And so that's important because it's just that direct signal to the thyroid that doesn't tell us anything about what's happening at the cellular level. So followed by the thyroid stimulating hormone, there's hormones for free T4, which is considered the storage form of thyroid hormone. Free T3, which is the active form of thyroid hormone. And I put active in red because that's where we get our bang for our buck. Thyroid T3 in particular really needs to be optimized for adequate thyroid function. The other main level is a reverse T3. So this is like a primal mechanism that our body has to conserve. So during times of famine, when we don't have access to food, our body wants to be in a conservation mode. And so reverse T3 will be stored in those situations. Now, in this day and age, there's a lot of other reasons that reverse T3 would be stored. So it is a marker that we measure with regularity to be able to look at the full function of the thyroid in the body. And then beyond that, we have the antibody levels for thyroid. So things like thyroid peroxidase antibody and thyroglobulin antibody, which will typically be elevated with Hashimoto's. And then thyroid stimulating antibody, which we'll see elevated with Graves' disease. And the other very important note here is that iodine is essential to the formation of thyroid hormones. So the reason T4 is called T4 is because there's 4 iodine molecules surrounding it. So that, lays a foundation, adequate levels of iodine for the formation of these hormones. So the role of the thyroid in the human body, I've said this already, thyroid hormone regulates metabolism, and it's literally in every cell of our body. So metabolism is important because it allows your body to pull toxins out of the cell and move nutrients in. You're going to see that it helps with production of proteins and cholesterol, regulates body temperature, regulates gut motility. It maintains our heart rate and our respiratory rate, and it influences central nervous system and brain development, as well as maintenance of muscle tone and vigor. So why is the thyroid so important for fertility and pregnancy? I put this note in that multiple accepted fertility and pregnancy ailments can be linked to thyroid dysfunction. So irregular menstrual cycles, early and late term miscarriage, fatigue, morning sickness, inappropriate weight gain, gestational diabetes, hypertension, preeclampsia, even carpal tunnel. That's an often misdiagnosed thyroid relationship. So I always talk about that one because 9 times out of 10, when the thyroid gets treated, carpal tunnel gets better. Swelling, and then digestive issues, constipation, gallbladder dysfunction. So more reasons why the thyroid is important for fertility and pregnancy is that those with a diagnosed thyroid condition prior to pregnancy are going to require more close monitoring of their thyroid function during the pregnancy itself. And they may end up doubling or tripling the dose that they were on prior to pregnancy because of demands that the pregnancy has on the body. And then we also look for triggering events for post-pregnancy thyroid dysfunction. So, pregnancy will take a lot of your body's iodine stores, and if you're not actively replacing that, that can set you up for a big thyroid flare postpartum. We think about the thyroid's relationship with postpartum depression, and we also think about its function as far as breastfeeding success and milk production. So this is just an article I posted from the Journal of Clinical Endocrine Metabolism, and this is the link between maternal thyroid abnormalities and adverse neuropsychological function of children at the 5-year age mark. So for intelligence, marked hypothyroidism was important, whereas for motor function and executive and behavioral problems, maternal hypothyroxemia was predominant. And basically what this means is if the thyroid was low, the kid is going to be at risk for these conditions at greater levels than if the thyroid is not low during pregnancy. So this is a laundry list of symptoms of low thyroid or hypothyroidism. And I'm not going to read every one, but just, looking through at the highlights. So cold intolerance, constipation, depression, anxiety, infertility, fatigue is huge, hair loss, headaches, irregular or heavy menstrual cycles, high cholesterol, which doesn't get a lot of credit as it relates to the thyroid as well as other hormone imbalances. First things first, when you go to a primary care doctor and your cholesterol is high, they want to put you on medication to lower it. But are they asking the question, why is it high? And then other things like high blood pressure, low blood pressure, muscle cramps, and carpal tunnel, as I mentioned already. So these are some of the symptoms of a hyper or overactive thyroid: anxiety, fatigue, heat intolerance, high blood pressure, palpitations, weakness, weight loss. And you can see that there's overlap, and that's what makes the thyroid even more complicated, is that you can have symptoms that look like hyperthyroid or high thyroid and it actually be a low thyroid. So it's important to be working with somebody that's kind of managing the symptoms, but looking in detail at the lab work as well. So then thyroid disorders can be further broken down into autoimmune, or the categories that are autoimmune. And so that's Hashimoto's or Graves' disease. And this is where measurement of the antibodies becomes really important, so we can determine, what category you fit in. And in my experience, many patients actually fit in more than one. We'll have thyroid peroxidase antibodies that are elevated, but they also have Graves' antibodies. And not every person with Graves has all of the, classic symptoms like a goiter and protruding eyes and weight loss. So, I made a little note that it's not black and white with all of the multiple overlapping symptoms that can exist. So we're looking at the factors that impact thyroid function. Top of the list, stress, which, currently in our state of affairs in this country, this is even more evident. But stress really, puts a damper on the hormone system of the body. We look at micronutrient deficiencies, so things like iodine, selenium, zinc. I absolutely can't stand the fact that artificial sweeteners are still on the market. I feel like they should be outlawed. They are particularly toxic to the thyroid because they affect how your hormones are converted. So, you end up having a deficiency in the cell when you consume artificial sweeteners. Other things to consider are allergies. So food allergies in particular, gluten, dairy, soy, amongst others that can impact the thyroid function. Then we look at things like toxic exposures. As I mentioned earlier, iodine is what makes up the thyroid hormones. And if you have a toxic overload of things like bromide and fluoride, which we refer to as toxic halides, they can actually bind where iodine is supposed to bind on the thyroid gland. And that's one way that the evaluation of the labs can be disrupted, because what looks like a normal lab value may show up because it, it's bound to these toxic halides and not iodine itself. And then even bigger on the radar these days are pesticides like Roundup, also known as glyphosate, and many other chemicals that can be disruptive. The other thing to consider is our environment. We live in a goiter belt, which is an area where there's an iodine deficiency in the soil. We think about things like heavy metal toxicity, and screening my patients. We're always asking questions about dental health. Do you have mercury amalgams? Do you work in an industry where you're exposed to toxic metals? Is there a concern in your home? Recent pregnancy is a factor with impaired thyroid function, other hormone imbalances. So a lot of times, as a woman makes the transition into menopause and there's a loss of progesterone and estrogen, that's when a thyroid problem is going to show its, ugly head, so to speak. And then other medications can actually impair thyroid function. And this isn't a complete list, but we think of things like amiodarone, which is used to treat AFib, and beta blockers, which is a common high blood pressure and heart rate controlling medication. And then, as discussed already, there can be underlying autoimmune processes that affect how the thyroid is going to function. So I stole this slide from Dr. Neuenschwander. He's the physician I practice with. And I'm not going to read every detail on this, but I like what it has to offer in terms of looking at basically, the thyroid, function of the thyroid originates in our brain. And then that communicates with the thyroid gland itself, and then that communicates with cells in the body. What's interesting about this slide, though, is there's all the potential toxic markers that can have a negative impact on each particular biochemical step in the thyroid cascade. So things like phthalates or pesticides really impact how thyroid communication is happening at the cellular level. And so say a chemical is in the way or sits on the receptor site where T3 is supposed to be making its conversion, that's not going to happen efficiently because that chemical is in the way or it's mimicking the function of the hormone. So really, getting rid of toxins, which we'll discuss some ways to address that, is going to be very important in maintaining thyroid health. So how to support the thyroid? We reduce toxicity. First on the list is diet. We are what we eat. It sounds like a cliche, but it is the most important thing that we can do for our overall health. So I stress to all of my patients organic and non-GMO food. It's just a high priority. The other thing is avoiding fish and foods that are high in toxins. So fish can naturally be high in mercury, and the larger they grow, the more mercury they're going to take up from the water. So that's one way that you can mitigate toxicity. Another is to stop consuming water or drinks out of plastic bottles. Plastic, as you saw on the previous slide, can disrupt the function of the thyroid at the cellular level. So we make recommendations about, getting a reverse osmosis or other multi-stage filtration system for the house that's going to remove heavy metals and pesticides and medications that can disrupt the thyroid. And another very important point about reverse osmosis is that you have to remineralize that water. You don't want to be drinking dead water. So any system you put in your house, making sure you're working with a professional that understands how to manage that. Other ways to reduce toxicity, consider using an air purification system in your home. And that really depends on where you live and deciding what kind of air purification is right for that area. Another really unidentified or not often thought about area of toxicity is our personal care products. So your lotions and shampoo and toothpaste and everything you're using on your home, if something's going on your skin, that means it's making its way into your bloodstream. And if it's full of toxins, that can be disruptive to the hormone system as well as to the thyroid. And then another great way to eliminate toxins is through this use of a sauna or other methods of sweating. My favorite is an infrared sauna. You can get a reasonably priced sauna for inside of your house, and 2 to 3 days a week, take steps to spend time in there so that you can cleanse these toxins via sweating, and it can be very helpful. More about the diet. So I talked about this already, but organic and non-GMO, particularly pay attention to the Dirty Dozen. So there's lists that get put out every year about the Dirty Dozen and the Clean 15. And I think the Dirty Dozen list is growing every year. So it's something like the Dirty 15 or Dirty 20. I'm not even sure what number it's at right now, because more and more of our foods are becoming too toxic to eat. But using that as a baseline for deciding what type of organic food you actually need to purchase is a baseline or a starting point. The other thing that was briefly mentioned, people that have autoimmune thyroid problems absolutely need to be gluten-free. The same genes that are associated with thyroid autoimmunity are also associated with gluten sensitivity and celiac disease. And the other thing to note about that is just because you don't have the genetics for it doesn't mean that it's not a problem. We refer to something as non-celiac gluten sensitivity, and that really has everything to do with the state of our wheat in this country and the fact that it's genetically modified and sprayed with a lot of pesticides. The other thing to keep in mind is that most of our hormones are made from cholesterol, so it's not a great idea to be on a low-fat diet. Cholesterol is the starting point for hormones, so you want to be careful about that. And in general, anti-inflammatory diets tend to be the best way to manage symptoms of hormone changes and to improve levels. So we look at paleo diets or autoimmune protocols. Even keto that's non-dairy can be appropriate to help manage these things. So I just put this slide up to talk about the concept of preconception to infancy. So preconception is essentially the time before you were to become pregnant. And what can you do during that period of time to optimize outcomes for your unborn child, fetal health outcomes. And I just think it's important to look at this relationship that thyroid health is impacted by nutritional deficiencies, it's impacted by toxicity, and that all has an impact on maternal health, which translates to fetal health. So we have to start early to address these problems. And that's giving us the hope that, our children's health outcomes are going to start to turn around, because it's simply unacceptable that we have such high levels of chronic disease in our kids today. And I think toxicity is at the root of a lot of that. So I start off the conversation about testing with, don't just settle for a TSH. The entire panel is necessary to tell this story, with the other note that most thyroid problems are related to autoimmunity. So if your provider isn't taking the steps to measure autoimmune markers, there's an untold story about the state of your thyroid health. And so you need to be partnering with a provider that's going to look at everything and help navigate that path with you. So this is a 2019 publication through the American College of Obstetrics and Gynecology. And basically their statement is that despite some of the concerns about existing data, level 1 evidence suggests no benefit for universal screening and treatment for hypothyroidism in pregnancy. And I just look at this, and through reading it, it makes me very angry. If you think about all the slides I just talked about, and in particular, the slides with all the symptoms and other relationships to thyroid health and chronic disease, it's just unacceptable that this isn't a routine part of our screening in pregnant mothers and mothers looking to become pregnant. So this is a European recommendation, or a study out of Europe that is titled "Universal Screening Detects 2 2 times more thyroid disorders in early pregnancy than targeted high-risk case findings. So over half, 55% out of this study of pregnant women with abnormalities suggestive of autoimmune thyroiditis and or hypothyroidism would be missed if they were only high-risk criteria that they use to screen for thyroid. And the statement that a more extensive screening of thyroid autoimmunity and dysfunction seems warranted. So this is very opposite from the last recommendation that was just made through ACOG. So here's just another article from 2018, thyroid screening in early pregnancy, pros and cons. So the statement here is that universal thyroid screening in pregnancy fulfills most criteria for a beneficial and cost-effective screening program and holds promise for improving fetal and maternal outcomes. However, there remains uncertainty, especially with regards to the significance of borderline biochemical abnormalities and whether correction of such abnormalities can improve outcomes. And they just make the final statement that a consensus is unlikely to be reached. And I just think this speaks larger volumes about the difference between conventional thinking and what we do in holistic and integrative medicine. You know, our standard for what's considered borderline when it comes to biochemical abnormalities or borderline thyroid tests is very different than what's going to be accepted through conventional medicine. So we base our decisions in my practice on the individual, not what a big, you know, educational body is saying is right about screening. You know, if you tick the box for every thyroid symptom, you need to have the test done, and there's just no exception to that, in my opinion. So to talk a little bit about what our workup looks like, I've kind of stated this already. It's essential that the workup include free T4 and free T3, as free T3 is active inside of the cell, as well as TSH and reverse T3, and then measuring the antibodies as I described already. And I always follow the antibodies in a serial fashion, because it's a good measure to know if the antibodies are improving with the lifestyle changes that are being made or the type of supplements or medication that's being used. It's not just, oh, you have Hashimoto's, have a nice day, but what are we doing about that and how is your body responding to it? And then just another note that I also have plenty of patients who have perfectly normal thyroid labs, but you know, have every clinical symptom under the sun, and they deserve treatment as well, because the labs don't tell the whole story. And, you know, if it were 50 or 60 years ago before we had these sophisticated lab tests, the decision to treat a thyroid was based on clinical symptoms, you know, things like basal body temperature and all the other, you know, markers that I talked about in terms of symptoms. So this is kind of the next level workup. So when I meet a patient, you know, we consider testing for other things, you know, the genetics for gluten sensitivity. We measure environmental toxins through urine samples. We can measure glyphosate or Roundup pesticide levels. If indicated, we look at other metabolic markers and immune markers, and then getting a handle on nutritional deficiencies as well as comprehensive gut health testing. So things like a vitamin D level and thyroid cofactors and B vitamins and fatty acids. You know, all of that lays a foundation for a proper functioning hormone system. And I couldn't practice without the scope or ability to look at these additional tests to be able to support a patient. And here I just talk about some treatment ideas, you know, absolutely under the supervision of a trained medical provider. You know, these are just conversations here, not recommendations for you to take home with. So in terms of medication, I primarily treat with natural desiccated thyroid. So this is commercially available, and it most of the products are derived from porcine or pig sources, so things like NP Thyroid, Armor, Nature Thyroid. And then there are some other over-the-counter bovine sources of natural desiccated thyroid. And then what's more conventional in a thyroid treatment approach are things like levothyroxine or Synthroid, liothyronine, which is T3 therapy. And then in rare instances, we actually have to compound medication, which means it goes to a specialty pharmacy and we determine what formulation is going to go into that based on the needs of the patient. So this is more evidence that, you know, thyroid treatment is not one size fits all, and we don't settle for less than optimal until that patient's symptoms have really improved. And then other approaches from a nutraceutical point of view, there's many thyroid multivitamins on the market, and then we work to replace things like iodine, selenium, zinc, magnesium, to give the thyroid all of those cofactors that it needs to function properly. And then lastly, you know, we're looking at addressing gut health. So there's different detox protocols, you know, addressing toxicity. So if there's a high level of heavy metals in the body, maybe, you know, chelation, which is the process of removing heavy metals from the body, is something that needs to take place. And then addressing immune dysfunction. And there's a variety of different ways that we work to do that. So to summarize, you know, optimized thyroid function is essential to a healthy pregnancy and to a postpartum period of time. You know, we need a preconception to infancy plan that's going to lead to optimal fetal environment. You want to work with a provider who's paying attention to clinical symptoms and not just lab values. It's going to be necessary to eliminate environmental toxicity and inflammation. And the most important thing, if you take anything away from our talk tonight, is that you don't have to settle for feeling like crap. And that's not something I just can't stress that enough. And especially if you're pregnant, you know, those typical acceptable pregnancy symptoms may often point to a thyroid problem, and you just shouldn't settle for feeling unwell. Pregnancy is not a disease. And so try to be your own advocate and work with somebody that's going to help you on these things. And then I just provided a list of resources here. So a link to the Environmental Working Group's website where you can actually do a lookup of personal care products and get other information about the health of your water in your community and a variety of things, all things toxicity you can find through the Environmental Working Group. I put the website down to a gut health supplement that I absolutely love. Dr. Zach Bush has developed a product called Ion Biome. And so it's designed to heal the lining of the gut and protect you from pesticides. I also shared in the third link there his nonprofit group. It's called Farmer's Footprint. And that's an advocacy plan that he has to help farmers transition from industrial farming practices to more non-GMO organic ways of farming. The fourth link is just a list of high mercury fish. The fifth link is Dr. Stephanie Seneff's website. She's done a lot of research on the health effects of glyphosate or Roundup, the pesticide that's sprayed all over our food. And then the last one there is a link to a resource sheet about dental mercury amalgams and the health consequences that are related to, having those in your mouth. And that is the end. So we are going to take some questions. Are you with me, Jenny?
Yes, can you hear me?
I can.
Cool. Okay, great. I'm going to read the first question, and if anybody else has questions, just go ahead and send those in the chat box. The first question I have is, When should someone who is hoping to get pregnant begin thinking about addressing toxicity or nutritional deficiencies and thyroid health?
If I had my way, at least a year before. I think that's an adequate period of time to get going on, medication or a detox plan. But I would say a year is a good amount of time.
Perfect. Okay, second question is there a certain age when thyroid issues usually start, and can children have thyroid problems?
I don't know the answer to the age. I think that's variable. A newborn baby can have thyroid problems. We worry about over prescribing iodine in pregnancy because that can set the infant up to have very overt low thyroid symptoms when they're born. I've had 6 and 7-year-olds on thyroid medication. I see a lot of symptoms crop up during puberty. So I don't know that there's a particular age. I think, it's dictated by environment and family history and so many different factors.
Okay, another question we have is what are some consequences of untreated thyroid problems? And I'd also like to add on specifically to pregnancy in addition to that.
So I think I put up a good slide. I can probably go back to that. So I think the consequences are everything we end up seeing that can be a problem in pregnancy. So fatigue, constipation. I've had women who previously had high blood pressure during all of their pregnancies, and then they got in to see me, and we treated their thyroid, and the high blood pressure wasn't a problem for that particular pregnancy. Fetal health consequences, it's growth and development of the brain. When you look at how the thyroid is, affecting protein metabolism. So that has a lot to do with tissues being formed properly and, everything development, because metabolism is at the root of what's being controlled by the thyroid. So I'm not sure if I answered that, but.
Mm-hmm. Another question is because I had a thyroid issue during pregnancy, will my baby have it too?
That's possible if it's not regulated properly. So the thyroid is, or the baby is relying on your thyroid function in the first trimester. And at that point, their own thyroid is going to, start to grow and develop. So, yeah, I mean, you have to have adequate levels, so baby has adequate levels. There's just no way around that.
There's another question that says, can vaccines cause thyroid issues?
Yes, vaccines have toxins, they have heavy metals. Without a question in my mind, I think they're a factor.
Okay, another question is having an autoimmune disease, psoriasis, can that lead to autoimmune hypothyroidism?
Yeah, and I asked the question, what comes first? The psoriasis may be a secondary effect of an undiagnosed thyroid problem. So we find that autoimmunity it comes, in succession. So if you have one autoimmune problem, you're more at risk for another. And if you're not checking, the thyroid completely, that may still be at the root of the other problem. And with psoriasis, we think a lot about gut health too. I tell my patients anything happening on the skin is a reflection of what's going on in the digestive tract. So.
Perfect. I have a question, and that would be, if you were maybe borderline hypothyroid, preconception, pre-pregnancy, and it really wasn't causing you so many symptoms that it was flagging you as, hey, there's something going on with my thyroid, pre this conversation, would pregnancy in itself be enough to kind of kick you into a more hypothyroid state if you were already predisposed to that before pregnancy?
Yes.
Okay.
I mean, I think the energy of the development of the baby, you know, that's pulling resources like minerals and fatty acids. So I think most certainly that's going to intensify an underlying thyroid problem, unless, you know, the switch flips and nutrition just turns right around. You know, there's some drastic change there.
Okay. Another question that came through is, can autoimmune Hashimoto's be reversed, or is it lifelong? And how long does a detox typically take?
So the short answer, yes, it can be reversed. It's complicated because you always have the genetic predisposition for that autoimmune state. So, you know, I met people with thyroid peroxidase antibodies over 1,000, and that's essentially off the charts. And we change their diet, you know, get rid of food sensitivities, work on gut health, and the numbers can fall back in a normal range. It's not always easy. It just depends on the person. And there was a second part to that question too. What was the other part?
It was, how long does a detox typically take?
That's variable as well. I think it depends on the level of dysfunction, and detox is a very broad term. So what are we detoxing? Are we detoxing high levels of yeast and bacteria in the digestive tract? Are we detoxing heavy metals? A combination of those things. So it's very hard to answer that. And then the other thing that we're doing more of these days is looking in detail at genetics. So complete genetic profiles that give us information on how well a person is equipped to detox, and, you know, what other risks do they have. So I wish that was a simple answer, but it's so complex.
Mm-hmm. Okay, another question is what are the ideal lab values if somebody were to have a full thyroid panel ran?
So that depends a little bit. I think I don't prefer to settle for a TSH any higher than 2. That is always paired with an evaluation of T4 and T3. So T4 should be above 1. I don't like to see a T3, free T3 less than 3.5. And then the reverse T3 should be at the low end of the normal range. And as far as antibodies go, we shouldn't have any antibodies. You know, they should be negative. That's the ideal state.
Okay. I was going to say, I know for TSH and for other lab values in general, even a vitamin D lab, the ranges are large. And I know for a TSH, you know, the lab value might say between, you know, 1 and 4 or 5 or 6, depending on the lab. So when a person goes to their practitioner and they get their TSH back and it's 3.5 or 4, and they're like, okay, it's normal, we don't have to do anything else, and or the provider is resistant to ordering labs that you want, how would you counsel somebody moving forward to be able to obtain the information that they need for their thyroid labs?
Get a new doctor.
Good answer.
I mean, it's hard to convince. You know, I get calls every day. So, you know, most of my patients maintain a primary care provider. And I get calls every day about, oh, well, I went to my primary care doctor and they think my TSH is too low and they want to lower my dose. And, you know, it's changing a whole system of medical education that I just don't think I have the capacity to or ability to do. I mean, this is a functional way of thinking about thyroid health. And, you know, I think because conventional providers are so busy, they may not be as well read. You know, in our practice, we are always going to conferences, we're reading the latest literature, we're not settling for what we learned in school. You know, if your provider is settling for what they learned in school, they're already years behind in terms of adequately treating people. So.
Excuse me. Another question is what if the lab numbers seem off, but the client is not symptomatic, so they're not having anything on that list? Could somebody's variation of normal be different than the numbers you said, or should it be considered maybe a hypothyroid just because the lab values are off?
I mean, the labs don't tell the whole story, for the good and for the bad. If somebody literally has no signals of thyroid dysfunction on clinical evaluation, I'm not going to treat them. That if you get stuck in that narrow way of thinking on that end of the spectrum, then, you're not going to serve people who do have a lot of problems. So it's just about treating the individual.
Perfect. At what point in the postpartum period should thyroid labs be ran? Whether that be they were ran and they were being monitored in pregnancy, and so now we're in the postpartum, or if somebody's having their labs ran for the first time ever in the postpartum, what would be an appropriate week past delivery?
6.
6 weeks. Okay.
And that's variable. If somebody's 4 weeks past delivery or 4 weeks postpartum and they have a wave of depression and, as I say, that's not so PC, if all hell is breaking loose, you need to move a little faster on that evaluation. So the individual really dictates when, but I would say as a general statement, 6 weeks.
Would you say that there is a high correlation with hypothyroid and postpartum depression that is kind of being overlooked?
Yes. Yes, yes, yes.
Okay. I'm actually like reading my entire list of my own questions as we go here, and I'm reading other people's questions as well. Let me see. Do you have a preferred brand of prenatal? Somebody asked.
I have a list of brands. We work with a variety of different supplements, and I use the term like physician grade, but it shouldn't be off the shelf at CVS. It shouldn't be even a prescription prenatal, because most of those are full of synthetic vitamins and fillers that really no person should put in their body. So things like orthomolecular, pure encapsulations, brands that, and I don't know about pure encapsulations very much anymore because they were bought by Nestle. So the jury's out on that one. But you want it to be free of toxins. You want it to be third-party tested. It should be gluten-free and dairy-free and soy-free. And, it's kind of an all-day job to try and figure out what supplements you could take or should take. But just making sure that it's higher quality is usually my standard.
Great. Another question is are thyroid issues ever connected to hyperemesis?
Yes. And I thought I mentioned that morning sickness, I think I have up on the slide that's still on the screen. Yeah, I mean, I make this statement about women's menstrual cycles. Our menstrual cycle should be a relatively uneventful time of the month for us. You shouldn't be bleeding to death and in bed with pain. And I feel like that transition into the first trimester of pregnancy is telling of hormone dysfunction if you are unwell and, have hyperemesis, and any sort of dysfunction means that we're missing the mark in terms of hormonal balance.
Gotcha. What about PCOS? That's a very common thing that we're seeing often. Is that correlated to the thyroid?
Yes. I feel like my answer about is it correlated to the thyroid is yes to everything.
Yep.
I don't know that it's 100% thyroid related. I think a lot about toxicity and that kind of points back to the thyroid too. But I've worked with patients who we treat their thyroid and their testosterone levels come down and their cycles regulate. But it, just as a caution, it can be more complicated than that. I ask about history of, hormonal contraceptives, and, there's just so much more to it. So
Gotcha. Would you say that low vitamin D levels, I know that's listed as one of the things that you screen for as well, but everybody in Michigan being so deficient in vitamin D, and that also not being a lab that is ordered very often by primary care physicians, would you say that vitamin D is contributing to this problem as well?
I think so, and just the information we have about it being, a modulatory molecule, it modulates our hormones. It's not just a vitamin. So it is related for sure.
Okay, another question that came through is, are all thyroid meds created equal? What is the reason for the different types?
No, they're not created equal. The natural desiccated thyroid medications have a blend of T4 and T3. They come from mostly pig-derived thyroid glands. The natural desiccated thyroids vary in terms of the fillers that they have. Synthetic T4 preparations like levothyroxine or Synthroid vary. If you get a generic variety, there's going to be a different filler cascade than you would find in a brand name drug. So people who are extremely sensitive or who have autoimmunity may require more thought about the fillers that are going into the medication they're taking or other allergens that they might be getting exposed to, because it is a drug you're taking every single day, and that can build up and affect your system. Did I answer all of that?
Yeah, I believe so. Is somebody destined to be on thyroid replacement medication for the rest of their lives, or is it something where eventually their body may kind of reset and start functioning optimally for itself?
I've seen people reset. I feel like it's rare. And I think the battle is our environment, toxins, terrible food system. You really have to be on top of all aspects of your health to wean off of thyroid medication. There are exceptions to that. I mean, sometimes people just need like a short duration of treatment as a reset. Sometimes you just need medication while you're pregnant, and then your body kind of kicks into gear after that. So there are exceptions to that, but a lot of my patients end up getting hooked on the feeling. You don't realize what it feels like to feel good until you do, and you have that gland of your body supported, and then the rest is history.
Another question that came through is, I'm 37 years old, very regular cycles that last 24 days. 10 days ago, I started supplementing with vitamin D, vitamin C, and magnesium. Cycle is 7 days late now. Not possible that I'm pregnant. Is this possibly correlated?
Mm-hmm. Yeah. Anytime you make a change, it can disrupt your cycle. So it's just a simple yes, it is very possible.
Okay, another question. I love all these questions. Thank you guys for writing questions. That really helps conversation flow. So keep them coming if you can think of them. The next question is, to get started with a thyroid makeover, what are the first 3 or the most important steps for someone with suspected thyroid dysfunction?
Think about food sensitivity. I start with gluten and dairy. I think those are 2 foods that can easily be removed, and within a reasonable amount of time, you're going to know if it's making a difference. Get your vitamin D, whether it's through a supplement or spending time in the sunshine. And just think about like a basic mineral supplement, getting your body adequate levels of selenium and zinc and iodine and magnesium. So those would be my top 3 things.
Perfect. When you talked earlier about the reverse osmosis water and then having to remineralize it, what is your recommendation for doing that?
So some systems you can build in a remineralization, so it's just part of the water filtration process. If that's not an option, they make something called like trace liquid minerals. And there's a variety of brands out there that provide you instruction on how much to put per glass of water or pitcher of water, depending on the volume. And then if that's not something you're interested in, I just have my patients salt their water. And this isn't something I really touched on. It's kind of a deficiency of this presentation, but adequate salt levels, and not like Morton's iodized table salt, but, Celtic salt or Himalayan or Redmond's real salt, salting the water like a 1/4 teaspoon to a liter, or, doing like a 1/2 teaspoon of salt twice a day just to keep your salt levels up. And most people are not sensitive to salt. So there's a very small percentage of our population who will develop swelling or high blood pressure when they consume salt. Most of us need it. And when you get one of those varieties, it's in an unrefined state. So it hasn't been stripped of all of the natural minerals.
Perfect. Do you have any data that correlates? I know that you talked earlier about blood pressure and pregnancy, but specifically preeclampsia, especially for somebody who has a history of preeclampsia linked to the thyroid, because I know in the medical model, the only option they're really giving women are to take baby aspirin, at the beginning of pregnancy and through, to help lower their chances of getting a secondary case of preeclampsia. But in your experience, do you know of any studies or data that link the thyroid to preeclampsia and then lowering the rate moving forward in the future pregnancy?
Yeah, I probably have a few of them buried on my computer. I can't cite them off the top of my head right now, but I know that literature exists. Now, the question is it mainstream? I feel like that answer is no. Conventional OBs and even some conventional midwives aren't making these relationships. So.
And I would agree with that in my own practice. We met at the end of last year, and I started doing a lot of thyroid research in January of this year, because January was Thyroid Awareness Month. And then we've been having a lot of great conversations around this. And since that time, I have been offering thyroid labs to all of my patients, and I had already been previously screening for vitamin D. And because we're seeing numbers, and we're also seeing what was normally presumed as normal pregnancy symptoms, which really were hidden thyroid issues, that when people were being seen and treated, they started feeling better. So it's been a huge learning curve for myself. And I also have the opportunity to see a lot of different labs from other providers when people transfer their records over to me. And I can say that if you're lucky, you have a provider that ordered a D and a TSH, and then maybe, if you're really lucky, maybe a T4. But I've never seen anything beyond that. And that's only been maybe 1 or 2 patients that have even had that. So I've learned a ton. And I think it's important that women who are trying to conceive, maybe they've had an infertility issue, or they've had a chronic recurrent miscarriage issue going on, or even just want to have a healthy, optimal pregnancy, that regardless of who their provider is, they request these labs and or find a provider that's willing to order them for them, so they can at least have the information to know what would their next move be if they need to get care from somebody who specializes in this.
Mm-hmm. Yeah, and I know since you and I started working together, we're trying to, sometimes our waiting lists are long where I practice, but pregnancy is simple. When I meet a new pregnant patient, 9 times out of 10, they don't have a whole lot of health problems. So we're able to squeeze them in and modify appointment times and make it work so that people you're connecting with are going to get care. So I'm trying to be available in that way, because I didn't realize what sort of unmet need there was for pregnant women to be, treated properly. So I feel like this is just the start of a really awesome collaboration. So
definitely. And Maria has been doing a fantastic job. She has seen a handful of my clients. They've been able to they have been able to get in to see her quite promptly. Their symptoms have been being turned around through care. And hopefully in the near future, Maria will be seeing more clients on this side of town, hopefully at my office or an office nearby. But currently her office is in Ann Arbor. It's Biomedical Energy, correct? Is that the name of the office?
Bioenergy Medical Center.
Perfect, perfect. Are there any other questions that anybody has in the chat room before we end it? Okay, it doesn't look like it. So just so you guys know, Metro Detroit Birth Circle, we normally meet in person in Macomb at 21 and Garfield at my Macomb office. We always meet the second Thursday of the month from 7:30 p.m. to 9:30. We have guest speakers that are community people that come and volunteer their time to speak on their specialty on topics that are surrounding the childbearing year and postpartum and naturally attached parenting topics. We always welcome you to message us ideas for topics that would interest you or your family. And when we are back to meeting in person, once all this quarantine stuff is over, babies in arms are always welcome. We do ask that younger children be left home with other care providers, and that you come healthy to Birth Circle as well. But follow us on Facebook. We're also on Instagram. The page for that is Metro Detroit Birth Circle. And the location for Birth Circle in Macomb is at Ben's Chiropractic. Dr. Sybil and I host that in person, again, the second Thursday of the month at 7:30. Any closing words or any other things that you can think about, Maria, for this meeting?
Yeah, just reiterating, don't settle for feeling like crap, you know. Everybody deserves more, and it's about advocating and just appealing to your provider. So take that as a message home tonight. Be your own advocate.
Yes, the CEO of your own healthcare.
Right.
I am so grateful that you came to speak here. If anybody wants Maria's contact information, you can find her on her website, which I will link to the Metro Detroit Birth Circle page. This is also being recorded, so we will be making this available as well. So please feel free to share that with your friends and family. While this talk was on the childbearing year and preconception, and in the postpartum, everybody should know their thyroid levels and at least be able to make informed decisions on what they may need for care. So this will benefit anybody, even if they are not in their childbearing year.
All right.
All righty. All right, well, we will close the session out and end the recording. Maria, thank you so much for volunteering your time. We really appreciate it.
You're welcome.
This was a very educational and eye